Today, we're going to demystify lichen sclerosus, a condition that affects so many people but is, very often misunderstood. We're going to break down what it is, who it affects, and most importantly, how you can manage it, all based on the latest medical guidelines.
For a lot of people, the journey with lichen sclerosus, we'll just call it LS from now on, it starts right here. It kicks off with this persistent, sometimes maddening itch that you just know isn't a normal irritation. If that sounds even vaguely familiar, well, you're in the right place.
All right, let's get right into it. In this first section, we're going to build a solid foundation. We'll cover what lichen sclerosus is, and just as important, what it isn't.
So here it is, the core definition. LS is a chronic, meaning long-term, skin condition that's all about inflammation. And let's just highlight that key phrase, non-infectious. This is so important. It is not contagious. You can't catch it from someone, and you definitely can't pass it on to anyone else. So who does this condition affect? Well, this is pretty interesting. While it's most often diagnosed in postmenopausal women, they're by far the largest group, you can see it's not just them. Men can get it. Even children can be affected. It really can impact people of all ages. And the guidelines also note that it seems to be more common in people with lighter skin.
Okay, this is a big one. We really need to clear up this harmful myth. The truth is, doctors don't know the exact cause of LS. They think things like your genes, maybe some autoimmune issues, and hormones could all play a part. But let's be crystal clear. It is absolutely 100% not caused by poor hygiene.
Okay, so let's move on. How does this condition actually show up? Knowing the specific signs and symptoms is, for sure, the very first step toward getting an accurate diagnosis and getting the help you need.
This quote right here really gets to the heart of what most people experience. The number one complaint? Intense itching. And it's got this specific personality. It often gets worse with warmth, which is why it can be so brutal at night and just completely wreck your sleep.
And this gives you a great idea of what a doctor is actually looking for. We're talking about more than just a little redness here. You get these characteristic porcelain white shiny patches. The skin can also get super thin and fragile. The term they use is cigarette paper skin. But then in other spots, it might actually thicken up. And because that skin is so delicate, you can get little bruises or painful cracks, which are called fissures.
This right here is why getting diagnosed early is so critical. If you leave it untreated, the inflammation isn't just a surface-level thing. It can cause permanent damage. We're talking scarring and even changes to the physical structure of the area. It's this risk of progression that makes consistent treatment so incredibly vital. So this brings us to getting a diagnosis. And I know, talking about these kinds of symptoms can feel, well, intimidating. But if you know the steps, it can make it all feel a lot more manageable. And it's actually a pretty logical process.
The good news is the path to diagnosis is usually pretty straightforward. It all starts with a conversation, just talking about your symptoms. Then the doctor does a physical exam, looking for those classic signs we just talked about. And honestly, in most cases, that's enough. A skin biopsy, where they take a tiny little sample to look at under a microscope, is really only needed if the signs are unusual and the diagnosis isn't a slam dunk.
Okay, listen up, because this is a really, really important point straight from the medical guidelines. It is so common for this persistent itching to be mistaken for a yeast infection, especially after menopause when, ironically, yeast infections become way less common. So the big takeaway is this. If you have symptoms that just won't go away, please don't self-diagnose. You have to get a professional medical opinion.
All right, let's get to the most empowering part of all of this, the treatment action plan. Now, while lichen sclerosus is chronic, the fantastic news is that it is absolutely manageable. You just need the right approach. So what's the go-to? The gold standard, the first thing doctors will turn to, is a potent topical corticosteroid. And no, this is not the over-the-counter stuff you can buy at the drugstore. This is a prescription-strength ointment that's designed to really powerfully knock down that inflammation.
And this treatment, it's not just a random use it when it itches kind of deal. There's a real strategy here. It starts with an initial phase, usually applying it once a day for about a month to get everything under control. Then you slowly, gradually reduce how often you use it over the next couple of months. And the whole point, the end goal, is to find the lowest possible dose you need, maybe just a few times a week, to keep the condition quiet for the long haul. So, beyond the prescription, what can you do every day to help yourself? Here are some simple do's and don'ts. On the do side, use a simple barrier ointment. Think petroleum jelly, every day for protection. Stick to your maintenance plan, even when you feel good. And wear loose, breathable underwear. On the don't side, avoid soaps on the area. Don't waste your time with unproven hormone creams. And, this is a big one, don't stop your maintenance treatment just because your symptoms have gone away.
Let's zoom out now and look at the big picture. How does this all fit into a proactive strategy for your health for the rest of your life? Because managing LS, it's a marathon, not a sprint.
First things first, it's really important to have realistic expectations. LS is a chronic condition, which means it's probably going to be with you for life. The goal of treatment isn't some one-and-done cure. It's all about long-term management, making those symptom-free periods last as long as possible, and effectively shutting down flare-ups when they do happen. Now, this is arguably the single most important reason for long-term care. There's about a 5% lifetime risk for women with vulvar LS to develop a specific type of skin cancer in that area. Now look, that risk is small, but it's not zero. It's real, and it is precisely why consistent long-term monitoring is just not optional. So ultimately, what does this all come down to? It comes down to you. You are the most important person on your care team. You're in the driver's seat. That means doing monthly self-checks to notice any changes, seeing your doctor for at least one checkup a year, sticking to that maintenance plan, and feeling empowered to talk about every aspect of your health with your provider.
So we'll just leave you with this question. The reality is, lichen sclerosus often goes undiagnosed for years, sometimes decades. And that leads to so much unnecessary suffering and a higher risk of complications. But by understanding the signs, by seeking help, and by talking about it openly, we can change that. We can help make sure people get the care they need exactly when they need it. Thanks so much for joining us.